Samantha. I did say Katrina, right? So
Yes.
Okay. So I feel like they're like family members now, Dr. So Samantha is a 62-year-old, has diabetes, has heartburns, BMI 42, and she's going to actually get gastric bypass at the end of our 18 weeks process. So what did we discuss in the past? Our care coordination process, what type of surgery they should be getting, different aspects of the bariatric surgery. But today we are going to actually talk about something that no one wants to talk about, but everyone wants to have it. We're going to talk about sex. Well, everyone is having sex, but can everyone have sex at the same comfort level, psychologically, physically? And one of the benefits of bariatric surgery is providing our patients the removing certain barriers. And I'm not just talking about physical barriers, but this includes the psychological barriers to live their lives just like anyone else. And what we know is, and then this is why it's, for me, it's extremely comfortable to have this discussion in this setting with someone like Dr. Irgau, because we don't look at any of these issues in a way that someone should be ashamed of, someone should be embarrassed. This is life. So we are as one whole. We have different issues, we have different ways of living our lives. And when someone is not able to, then if we can help, or what we do can help them, then we are here to share that information and then have this discussion. This is the second or the third time we are actually going through this, and it was not part of our regular cycle before we start doing this together. Why? Is because just like in some cases, it shouldn't be the case, but even in the medical field, there is the stigma. Well, we already have the stigma problem with the weight, with the morbid obesity. So we don't want to add another unnecessary nonsense stigma to this with like sexual health. Sexual health is something that is needed for any well-being, and it is necessary for people to live a happy life. And Dr. Irgau, I'm going to turn to you from here. And if you can tell us what our patients are going through and how we are able to help them while they're going through the process.
Absolutely. So it is interesting, Kemal, that when you look at obesity and its impact on the health of a person, there is hardly any area of health that is not negatively impacted by obesity. The favorite diagram that you and I sometimes show, the one from the Mayo Clinic, shows actually that every organ system in the body is negatively affected by obesity. And sexual health is not an exception, right? Morbidly obese patients, obese people are more likely to have a negative sexual health compared to others. This is related to some extent to the psychological impact of obesity on self-image and on confidence, which are very important in determining a positive sexual life. But also there are hormonal changes that are imposed by obesity that interfere with the health, with the sexual health of the person. So if you look at both men and women, both of them can suffer from poor sexual health related to obesity. And as I say, to some extent, this is driven by the fact that obesity is associated with a lowered self-image, with a lower level of confidence, right? That in part has to do with the stigma associated by obesity on society, right? Time and time again, we see that obesity is ridiculed, right? As if it is some person's weakness, as if it is some person's inability to achieve something, right? And that categorization does create low levels of confidence of people, low levels of self-image. And good level of confidence and self-image is important for one's sexual health, right? If a patient that comes to me after many years of struggling silently through obesity and trying time and time again to lose weight by themselves, one of the fairly common remarks I hear, Kemal, is that the patient would say, I don't like to look myself in the mirror, right? So if that is the perception a person has of themselves, just imagine of them exposing themselves naked to their partner. How would they feel, right? So if there is not that level of self-confidence, definitely their sexual health is going to suffer as well. So psychologically, obesity has a huge impact that deters a person from having a full, healthy sexual life. But beyond that, as I said, that there are hormonal changes also that can affect the sexual health. These are fairly clearly seen in men, for instance, Kemal, where men tend to have a lower level of testosterone if they are obese. Now, testosterone is an important hormone that determines many things in males. Actually, it is responsible for the deep voice that they have. It's responsible for bulking muscle mass, so giving them big muscles, strong bones, but it's also responsible for sperm production. It's responsible for sex drive. And if this hormone is decreased, their sexual drive is also decreased, which means they're going to suffer negatively from it, right? But there are other things as well, right? There is a much greater chance of having what's called erectile dysfunction in men when they have obesity, right? Which is a very important disorder of sexual health. This will affect many things, including the rate in which they engage in sexual intercourse. Obesity itself can affect the physical stamina of a person, so their performance may be affected, right? All these things accumulate and will deter a person from enjoying sex. So it does impact greatly the sexual health of a person. You're on mute, Kemal.
Sorry about that. So I had to mute myself, so that I'm not used to muting. So and we were having a little technical difficulty. So what I was saying is, again, just like any disease, these illnesses, they do have like similar personalities, like as far as being races, sexes, prejudice, like just like human, like if the disease actually is a human, so then they, like you just said, this has a different impact on men versus women. Now, one thing with our female patients is the menopause is a big part of the problem. Everyone is going to go through that at some point, and I think Samantha, being 62, she already had her menopause, right? So perhaps some of her weight gain is coming from the transition during that time, because many female patients, many people, many women, they are going through weight increase during that time. But if they have morbid obesity or close to morbid obesity borderline, the chance of them gaining weight during that time is even more. Not just how much they are gaining, but what percentage that they can increase, like how much they can actually increase the existing weight. That's a lot. So that's another trouble from that point, right, Dr. Irgau?
Absolutely. So the problem essentially is magnified, right? When you look at the situation in women reaching the level of menopause, because menopause itself does have a negative impact on sexual health of a woman, right? For a number of reasons. But as you correctly said, menopause also does encourage weight gain. So weight gain itself affects sexual health negatively. So you can see that they are being hit in a double manner, really, when they reach menopause. Not only there is the sexual health impact of menopause, which is negative, but menopause itself then leads to weight gain, and weight gain itself also adds to the difficulties in sexual health. So in the case of women, it's actually a much worse situation when they reach menopause, not limited to things like decreased arousal, decreased orgasm, and then increased pain as well in the performance of sexual activity. So all those things will really have a very negative impact in the overall quality of life of women. But it's interesting here, Kemal. You said sexual health is not something that many people talk about. Absolutely, we don't talk. I mean, in our society, it is something that is rarely discussed, even to the extent that it's not even discussed in a doctor-patient relationship setting as well. It is that viewed in such a taboo fashion, right? But so is obesity, Kemal. So is obesity. If you think about it, right? Obesity is viewed as something which is the fault of a person, right? Although the medical profession, although very late, has now come to terms to accepting that obesity is a disease. Society itself is far from thinking that way, right? And we see this in our patients that we've said before, right? Patients will come to say, well, I want to have bariatric surgery, but my family is against it. I want to have bariatric surgery, but my friends are against it. Meaning that, as you bring the example in the past, if that person said, oh, I have gallbladder problems and I want to have surgery, everybody will rush to support that person and say, yes, you should have your surgery, the treatment, so you can be healthy. But when it comes to bariatric surgery, because we're treating obesity, which is seen as something less than a disease by society, then people are not encouraged, which means that you're suffering from obesity, it's impacting sexual life, the suffering will be in silence, right? Which impacts greatly, the suffering itself. So when we talk about the sexual health of people who are suffering from obesity, we're not talking about just from the impact of obesity itself, but also from the fact that this is an issue that they hardly will bring up to talk to somebody. It is something that they suffer in silence, and that magnifies the impact of the problem as well.
So this is kind of interesting in a way that I just want to bring up this. So if I can. So let's see how quickly I can do these things. When we look at, and I don't, again, being in healthcare, and I was always kind of like the brave one when it comes to talking about different things and taking the risk. But I never thought that I was going to use that in healthcare. So, and, again, with the morbid obesity, with the sexual health problems, people are still like, sometimes like they act like if they're from 18th century, and well, that's not what we do here, and then we have responsibilities. Now, when we look at what sex does in our life, lower blood pressure, better immune system, well, it could be useful for COVID maybe, so better heart health, including lower risk for heart disease. So improved self-esteem, decreased depression and anxiety. Last week, I did an entire session before the Bariatric Friday for depression. Mm-hmm. The week before, it was about children's depression. Mm-hmm. The week before, it was another depression. And then every day when we go through the case conferences, people are being diagnosed and they are medicated for depression. Well, that's because there is something lacking in their life, not just for patients with morbid obesity. Natural pain relief, so better sleep. So all these things are benefits of sex. So then when I see our patients are not benefiting from this, then that becomes almost like, okay, so let's talk about sex. So that's why we have to talk about it and why it's important, because for well-being, for healthy life, people need to have sex. And we cannot just take this away from our patients. And that's one of the things that we want to make sure that everyone understands, that this is helping people to go back to their normal lives. And normal life includes all the other aspects, including sex. So now, Dr. Irgau, the other thing that I wanted to ask you, like, what's your overall discussion with the patients? Like, how do they bring this up to you, or do you bring it up? Are other surgeons, do they talk about it? You know how I always talk to the primary care physicians when they are not addressing the morbid obesity in the exam room. So even the patient does not bring it up, I want them to bring it up, because this is a chronic problem. But now, when we come to our exam rooms in CREAS, do you guys talk about this? Do they bring it up?
So it is interesting, Kemal. So some patients do bring it up. Obviously, we are talking about, when we see patients for bariatric surgery, we're talking about the root cause of all problems. Obviously, that is the obesity, and we're addressing it head on. That's the main issue. But it is interesting how the issue of a unhappy sexual life comes up as well, right, Kemal? For instance, one of the questions I may ask patients would be, are you preparing them for bariatric surgery? I would say, are you using birth control pills? It's not small, the number of women who would say, oh, I don't have sex. Just like that, right? And meaning that they have accepted that they have accepted that situation as if it is okay for them, right? And yet I can see that the struggle with obesity, this massive amount of weight that is really a burden on them that they have to carry with them day in and day out, is not only affecting them physically, because it is a weight on their joints, it's a weight on their back, it is causing them high blood pressure, diabetes, and so forth, but it is also affecting them psychologically, their self-image, right? Seeking partners, right? Being confident with people who are seeking their company. Those things are lacking, right, Kemal? And you've talked about how poor sexual health can lead to depression. Well, with obesity, there is an interplay between all these factors, of course, Kemal, right? Because obesity itself is also a cause for poorer mental health, for a high level of depression, right? So when there is that level of unhappiness, when there is decreased self-image, when there is decreased self-confidence, it is no wonder that there is going to be poorer sexual health as well.
So I think that's kind of like, that's maybe one of those where we can actually make it as part of our overall patient flow with documentation, and just making sure that even if patient, because like as a patient, sometimes we do feel a little bit perhaps embarrassed to bring up these things. But I think the way that you are saying, like opening up that discussion with the birth control pills and even the activities, sometimes when our medical assistants are taking when they check the patients, and they do ask actual questions. And even, in fact, in my own office, in our primary care setting, that's one of the questions, and I have to answer our MAs in the exam room. So it should be, again, it should be discussed just like any other health issues, but also like not just discussing it, but knowing that, this is kind of going back to the same issue. If we are really fixing the root of the problem, root cause, or are we just really troubleshooting? So morbid obesity is the originator for many other illnesses, and this is one of them. So And then that's why we have to really go to the root of the problem and then fix the weight issue, because giving a patient medication, because this patient may be already on so many different medications, and adding another one is not going to make it easier from the clinical management standpoint. So, one thing that I want to share, we were at an event, you and I, just this past week, a couple of days ago, and one of our patients was working in the event. I know we satisfy with what we do, but hearing it from the patient, so she had her surgery in February, and actually I was one of the reasons for her to go back again. So because she started the process, stopped the process, and then went back in, and this time maybe the connection that she had with me, we were able to keep her go through the time and until the date of the surgery. And she was giving us a hug, right? Although with the COVID we shouldn't, but we couldn't stop that. She was so happy. Mm-hmm. She said, "I'm energized. I feel a lot better. I just, I'm a different person." And all she lost so far is only 30 pounds. Now, 2 months from now, it's going to be 50, 60 pounds. And I can imagine what's going to happen in her life. And that's what one of our reasons for us to kind of bring all these different things to get more buy-in from our patients is, look, this is the right thing for you. And when you see patients who already have the surgery and have the results, then you'll understand that this is the right approach. Because, Dr. One of the other things that I want to just tell you, in our ACO case conference, half of the patients have morbid obesity problem. It's just like the BMI, and then we just look at the other results. So I'm in one group, just like our bariatric, and then Donna is leading another group, and Sean actually is my business development extension. So, and then we've been taking screenshots of what was happening to those patients who were not treated, who had morbid obesity. And the interesting graph is their weight is just going up. Mm-hmm. So 270, 2 years later is 320. Mm-hmm. 225, 2 years later is 270. So that's the numbers are right there. So that's why we have to act quickly, proactively, so that we can actually get to the resolution earlier, because the weight stays with the people longer. It becomes more difficult to deal with it. And you want to live your life. You don't want to delay the life, right?
Absolutely. Absolutely. So this point that you're bringing up about the progressive and chronic nature of obesity, Kemal, is very important, right? Because that's the one issue that, we are kind of lulled into thinking, yes, I have a weight problem. And then we think that weight problem will stay where it is, right? Despite our efforts. In reality, particularly for people who don't weigh themselves very frequently, they are shocked, right? When they weigh themselves 2-3 years later and they see how much more the weight has gone up. And guess what? The problems we are talking about, the problems of quality of life, problems of sexual health, the problems of self-confidence, self-image, all those problems are just going to get worse with increased weight, right? The weight is what is creating the problem, and increased weight will just worsen the situation. And clearly, people are not happy with that. They know that. And nobody wants to be at that weight. And people try very hard. The problem is not understanding that obesity is a disease. It has to do with the biology that drives the weight, leads people to just try the same methods over and over again with the same results, with the weight just going up year after year. So what we have demonstrated, Kemal, is that currently, by far the most effective treatment we have for morbid obesity is bariatric surgery. Of course, bariatric surgery is not for everyone. It doesn't mean that everybody is a candidate, right? People have to come to our office, do a consultation, making sure that this is the right choice for them, making sure that they are in the right state of mind for this, making sure that they are able also to commit themselves to important changes afterwards for them to be good candidate for bariatric surgery. But once they have bariatric surgery, then their quality of life improves. People are happier. They have better self-image. It's not a surprise that you see many patients after bariatric surgery, Kemal, announcing that they are going to get married, right? Just because that level of self-confidence and happiness has led them to seek partners and to be happy in relationships. Surgery, as we have said many times, deals with morbid obesity as a disease, and morbid obesity is defined as a weight which is at least 100 pounds higher than the person's ideal or healthy weight. So if a person's ideal or healthy weight is 150 pounds and they've gained weight and now their weight is 250 pounds, that is the definition of morbid obesity. And currently, bariatric surgery is by far the most effective treatment that we have for morbid obesity, which is, as we've said in many other sessions that Kemal and I have presented here on Bariatric Friday, morbid obesity is actually the root cause of many other ailments that are so pervasive in our society, whether it's type 2 diabetes, high blood pressure, sleep apnea, and many other illnesses. And we talked about this on our last session.
So, Dr. Thank you for covering me.
No problem.
So it's just the worst time because Isabel went to pick up her kids and I'm by myself in the home office. So, well, it's part of the pandemic, right? So,
of course.
Pandemic has some good benefits. I guess we learn how to do a lot of remote stuff like remote working, remote education, telemedicine. So, but also it has other disadvantages. Many people may gain a lot of weight.
Yep.
Now, our group, our specific demographics that we are looking for from our specialty is from the bariatric side. So morbid obesity, patients who are already diagnosed with morbid obesity is the main issue, who maybe suffer even more during this time. So they were already maybe almost a better target for pandemic because they were more vulnerable to the disease, to the pandemic, to COVID-19. If I'm not mistaken, our own number, we were at 62 or 63% of our patients who had COVID were morbidly, either obesity or morbid obesity already diagnosed. So now when we are going through this, now we see a lot of studies. Pandemic has so much impact on people. Just earlier in the session, I know it's your clinical hours and you do normally follow up, we catch up over the weekends, but we discussed the social determinant of health. And this is directly related to that because pandemic changed that in a very drastic way. So now these patients, they have a new norm, and everyone, including myself, we all have a new norm. So again, there are some benefits, but there's also a lot of disadvantages. Disadvantages many people don't even know, and long run, we are going to probably see those even more. But just looking at from the weight gain standpoint, we just want to be able to provide some support for our patients. What can be done, what is happening, what happened already, and how we can actually help them and what's available to them.
Absolutely, absolutely. So clearly, as everybody knows, with the pandemic, there has been a general gain in weight. There's no question about that. Everybody that you know, you talk to, they will tell you, or you can tell that they have gained weight during the pandemic. At least most people, right? And from our own practice, obviously we see that, right? We see patients that are coming looking for bariatric surgery when they were not at that stage before the pandemic, right? The pandemic has pushed them over the limit. Now they are candidates for bariatric surgery, and we see that. We see also that patients who've had bariatric surgery in the past, when we follow them up and we haven't seen them for some time during the pandemic, we see that they actually had lost focus and have struggled with some weight regain or plateauing of their weight loss during the pandemic. So as you correctly said, the pandemic has been definitely a trigger for weight gain. And this is actually not very easy to miss when one looks at what factors make people gain weight, right, Kemal? Eating more and exercising less. And the pandemic was a perfect setup to push these two things together, right? So if you look from eating more, snacking more, eating less healthy foods, that very often is pushed by the stress associated with the pandemic itself, right? There was a lot of stress because of the pandemic. People were afraid of getting the disease. That by itself, particularly with the news of its not being known very well at the beginning of the pandemic, there was a lot of stress of people really not knowing what to expect or fearing they might get the illness itself, right? There was loneliness because people were totally isolated for great lengths of time, right? Some people lost close loved ones that they couldn't even see because of the pandemic. Mm-hmm. There was a total disruption of the work-life balance, right? You are at home, you're at work, you don't know exactly what's going on. And some people had to take multiple responsibilities at the same time, for particularly, parents who had to take care of their kids at home, and then they had to work at the same time, things that they were not able to handle because of that. Many people simply lost their jobs, Kemal, because many businesses had to be shut. So stress clearly was a big factor. In this very stressful situations, it's understandable that people lose focus and rely on eating to relieve that stress. So eating unhealthy foods, snacking more, and also the pandemic itself, because particularly at the beginning, there was no clear idea of whether food would be available in the stores. People were hoarding a lot of food, right? So, and with that combination, it was not surprised that people were consuming far more food during the pandemic than they would otherwise. So that's the one component, right? And then the other component, Kamal, is lack of exercise, right? If people are locked down in their house, they are not out walking. They are not in the gym. They are not in the stores. They are not in the malls, where at least a little bit of physical activity would happen. Instead, they would be at home. And when you're at home in such high stress situation, you're probably sitting watching TV, and anxiously seeing what's happening, right? So the activity level, in fact, if we were to survey, people who usually track down their steps, how much they walked, right? And if they looked, I wouldn't be surprised if many people really drastically noted a decrease in how much movement they were doing if they looked at their smartwatch during the pandemic.
But, we went through this all together, right? So
yes.
Now, the simplest exercise is walking.
Yes.
It doesn't cost anyone anything. You just need to be in a safe street, safe in a way that traffic is, we don't want anyone to be killed on 95, so we don't walk on 95, just be somewhere safe. So this is simple, right? Simple solution. Why do you think people wouldn't want to do that?
Because it's very interesting, Kamal. If you remember, even now, actually, you see a lot of people walking with their masks on, right? Mm-hmm. And if there is a walking pathway that barely allows two people to walk through, and if two people are walking in opposite direction, as soon as they see each other, the one person actually may cross the street and go to the other side so that they wouldn't be too close to that person, right? So there is a lot of fear. There was at least a lot of fear, particularly early on in the pandemic, about how this would be transmitted. The issue of social distancing was taken to really extreme levels in some situations, right? Where people would not want to be any close to somebody they don't know, right? And what's the easiest solution for that? Is to stay home, not walk at all, right? Now, getting out, taking time to walk requires effort, right? When you have an excuse like this that is really pushed by the fear of the disease, it's no surprise that most people didn't go out at all, right? So clearly, as you said, the foundation of our movement, which is walking, was far less, right? Now, if you add to that the fact that people didn't go out to do chores, to go to work simply, right? If people didn't go to work, come out, it means that they didn't even do the walking that they used to do from their parking lot to their office.
Yeah.
They didn't, right? They didn't go down from their office upstairs to the cafeteria downstairs for lunch. If they used to walk to do that, right? They didn't go to the stores, to the malls, where even a little bit of movement was possible. So if you look at the whole lockdown mindset, it was almost a great setup for obesity to flourish, and flourish it did, right? But from our patients' point of view, Kemal, this was really disastrous. And it was disastrous because our patients are on the high level of weight to begin with, right? We're talking about people who have 100 pounds or more excess weight. When you are at those levels, it's so much more easier, so much easier actually to gain weight than it is to lose weight. So if you take a person who's a little bit overweight or normal weight, and then you take another person who's morbidly obese and you put them in the same situation as far as eating and activity, you will see far more weight gain on that person who is morbidly obese. And this is because obesity begets obesity. Obesity is a platform for further weight gain. So when we're talking about weight gain of the morbidly obese patients, we're not talking about 3, 4, 5, 10 pounds. We're talking about 30 pounds more, 40 pounds more, or even. So the morbid obesity in this situation becomes even more disastrous. So, and that's, it was no surprise that we see much more requests for bariatric surgery after the pandemic. Come on, because people who were at the edge, right, or who were morbidly obese before, now within a very short period of time, their weight shot up. So clearly, the damage of the pandemic is not only relegated to the fact that, a lot of people obviously died because of the virus, a lot of people got very sick, and many other things happened, but our health really suffered considerably, even when we were not affected by the virus.
Last week, Dr. Ban is saying our bariatrician, she was the clinical presenter, and as she was explaining the bariatric morbid obesity population, not from the non-surgical side, how the disease itself is actually sexes, races, all the bad habits of bad people have, this disease have. So one of the studies from the advisory board actually published, even during the pandemic, like the Hispanic adults, they gain more weight than the white adults. So just like how, and we also discussed the social determinants of health earlier session, how these are connected, and like what must be going through when situation changes for people. Like, as when you were saying that people have, when they stay home, like today is the home office day, the kitchen is right here. And the fridge is, there's nothing between me and fridge.
Right.
And in the office, it's different.
Right.
So, and
right.
That convenience is a problem.
Yes, no
And
question.
if we were dealing with the morbid obesity, how much of a problem that would be is it's like multiplied by 4 or 5, right?
Yeah.
So that's kind of like everyone is probably having different types of reaction to this. The other part of this study that Let me actually make sure that it's a couple of the graphs that's coming up. So the people from generation Gen Z, they actually gain more weight. Younger people gain more weight. So that means they probably were not ready for this type of change in their lives, and they didn't make any adjustments, or they maybe play more games, or they probably this is 18 to 24-year-old, the one that it's showing up on this bar here. So these people, they were not probably able to do what normal younger kids would be, because people who have jobs, they were motivated, or they were more disciplined to do certain things without having those issues. Now, again, when we add the morbid obesity on top of all the problems that we are having, everything is multiplied by 4, multiplied by 5.
Absolutely.